Hi everybody, this is Drew Salins from Zero, the End of Prostate Cancer. I wanted to share some news with you this afternoon. The United States Preventive Services Task Force finalized their recommendation for the prostate-specific antigen test that screens for prostate cancer. It used to be a D recommendation back in 2012 and through the present, but today they've upgraded it to a C recommendation. And what that means is they used to say D, don't see your doctor at all about prostate-specific antigen testing. Now they're saying C, and have a conversation with your doctor about the risks and benefits of PSA testing for you personally. And that's good news. I want to share 3 quick thoughts with you about the recommendation. First, good news is there are 3 bodies that have prostate-specific antigen recommendations: the American Urological Association, the National Cancer Comprehensive Network, and the USPSTF. They all agree in some form or another that men should have a conversation about this screening with their doctor. And that's great news because it creates consistency and clarity for the first time. Secondly, I want high-risk men, so men who are African Americans, some veterans, and men with a family history, to know that this data set may not be representative of them. So the data used to make the recommendation is a large data set that might not have included African Americans, men with a family history, or veterans, and you really need to make a personalized decision based on being in one of those high-risk groups about when and how often to get screened. So again, have a conversation with your doctor if you're in one of those groups. Lastly, and unfortunately, the recommendation says that men who are 70 or over should not get screened, still has a D recommendation. In my life, I've met a lot of men who are 70 or older who are living really active, meaningful, productive lives, and they have a right to know whether they're at risk for prostate cancer. So again, depending on your goals and your health and where you are in your life, you might consider getting a PSA and talking to your doctor about the risks and benefits. Those are my 3 thoughts on the recent recommendation today, and I appreciate you tuning in. If you want more information, visit us at zerocancer.org.